Hello. In this Fern presentation, we will talk about the emergency department care of patients with dizziness and vertigo with the goal of diagnosing and treating serious central etiology for these symptoms. My name is Edward Sloan. I'm an emergency physician in Chicago. I've served as the Fern president and board chair for over 3 decades. I have no financial conflicts. Please go to our fern.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. And follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, fern.org. So in this video, we will talk about Part 1 of the ATTEST clinical pathway, looking at general medical causes for dizziness and vertigo. This comes from the good monograph written by Dr. Jonathan Edlow for EB Medicine, The Timing and Triggers Approach to the Patient with Acute Dizziness. So in this part of the clinical pathway for the ATTEST approach to ED patients with dizziness, you ask this simple question. Does the history and physical exam suggest a general medical cause? If so, stop. Treat that medical cause. Treat hypoxia, hypotension, hypovolemia, hypoglycemia if they occur. And so, if the patient has no worrisome symptoms and an evident general medical cause, we go ahead and treat it. Now, if the patient appears to have a general medical cause, but they have a worrisome diagnostic finding, such as worrisome nystagmus or arm dysmetria, or truncal ataxia when sitting, then instead of simply treating the presumed systemic or general medical cause, we move over here and then consider the dizziness more fully because we found something that's worrisome on their exam. So this highlights these 2 parts of the ATTEST clinical pathway in yellow, addressing a general medical cause for the dizziness symptoms. So, you say, is there a likely medical cause? Yes. Are there no worrisome signs? Correct. In which case, if there's no worrisome nystagmus, the patient can sit and stand, no motor abnormalities, no arm dysmetria, no vision, speech, swallowing, or sensory changes, then you can treat the general medical cause, and it's not clear that a CT is even indicated in that case. I put an asterisk by sensory because when considering dizziness and vertigo, pain and temperature testing will be as important as is light touch. So, Part 1 of the ATTEST clinical pathway addresses whether or not there's a possible general medical cause, and it's pretty straightforward how we treat them and how we divert them if there's anything on physical exam that suggests a more worrisome central cause of the dizziness, lightheadedness, or vertigo. For comments or questions on this video and or any other Fern content, please get a hold of us at fern.org at gmail.com. Thank you very much and have a good day.